Okay, Anne, can you tell us a little bit about yourself and what you do?
Sure. Hi, I'm Anne. I'm a craniosacral therapy practitioner, and right now I have Joe on the table here. We're just doing a little demonstration to let you know a little bit more about it. And I think you're interested in knowing a little bit about the somato-emotional release.
Yes. You had mentioned something about, first, I remember you saying that craniosacral therapy can be used for trauma victims and kind of a holistic approach as we do therapy with them. You mentioned something about an energy cyst and how it can impair some other functioning and how, this can, I don't know, how did you correlate that between the somato, is that somato?
Somato-emotional release. Well, in craniosacral therapy, we're actually, it's a very light touch, hands on the body therapy, and as you can see, I'm just holding still, and I have my left hand, which is at the base of her brain, kind of,
Okay.
and then the top hand is on her forehead right now, but just very lightly, like the weight of a nickel, 5 grams. And I tune into the rhythm of the cranial system. The cranial system impacts the entire body from head to toe, impacting the nervous system. And basically, I wait and stay in this position, hoping to let the body recalibrate and also lean towards self-healing.
Okay.
We're looking for releases in the body, and sometimes it's a physical pain or a dysfunction, and it can be from a physical injury, but it can also be from another type of trauma.
Okay.
And as you know, the body holds things in the tissue. There's memory in the tissue that a traumatic event can affect them physically as well as emotionally. So the somato-emotional release is a response that it's when an emotion that's been buried deep inside the tissue and basically has encapsulated itself so it won't spread throughout the body, becomes softer. There's a release right there. It's often a sign of a release, a big, deep sigh. And but sometimes even in a nonverbal situation, I'll feel the energy release, and it's kind of a different feel. It's a swirling and an impact, and sometimes the person on the table doesn't necessarily even feel it, but it dissipates and just goes away. Now, other times there's much more of a reaction in the person, and tears may come, a little bit of crying and weeping, but it's not too horrific. It can be upsetting at first, but when a therapist can talk you through it and help you understand what it is and dialogue a little bit, just to help move that through and get it out.
Like some journaling, you said afterwards. Sometimes you suggest that to people. Is that what you said? No,
that's a good one.
I thought you said something
I did
about.
say that earlier, but
Okay.
That's certainly something I know that can be very beneficial. So.
Okay.
Yeah.
Okay, good.
Anything else?
That's about it.
Okay.
No, thank you, Joe. Thank you very much, Anne.
You're welcome.
All right.